we'll talk about this a little bit later, but over time when people have CBD in their system, it takes less to actually have that same effect. So you got to take it for about 7 to 10 days in order to start stimulating those receptors. And after people start taking it, say for 3 or 4 weeks, then sometimes if they stop taking it for a little bit or a couple of days, they don't have to have that ramp up period because the body's already understanding how to signal those receptors when stimulated. Okay, now influencing metabolic factors. So this is what also changes everything, which is also occurring in most drugs, believe it or not, is that everybody has their own individual SNPs, and everybody has their influence of their microbiome. Microbiome being the gut, which everybody knows, right? So you look at the probiotics, like overgrowths and leaky gut and any kind of inflammatory aspects and dietary aspects. This affects how you're absorbing, as you know as well, just as much of your Chinese herbs, just as much as prescription drugs. If the gut is off, right, which Chinese medicine is great at doing, is we always focus in Ayurvedic medicine, which we always use as well, is always focusing on fixing the gut. So if someone's taking CBD and we give it to them, they're not responding, or if they're using it before they came to see me and they're like, oh, I don't notice any difference, or I haven't noticed anything since I've been taking this, and I ask them gut questions, they usually will have a gut problem. We fix the gut problem and then the CBD will work even better. Now, I'm just going to highlight a couple of things because I want to get on further here in our discussion, but different inflammatory conditions, pancreatitis. Now, these are studies that have been done in the animal model, and there's a couple of things that I'll be showing you that's also happened in actually patients, and we're moving into more cell cultures of human cell cultures. Asthma. So again, a lot of patients have asthma. So again, taking this, now it's not going to be for the acute, like, I have an asthmatic attack and I need, no, you need to take an albuterol. But when people take the hemp oil, consistently, and we'll talk about dosing towards the end, but when they take it consistently, then their need for a breakthrough inhaler reduces over time because we're just down regulating the mast cell activation. So it's kind of this antihistaminic effect. So instead of them taking steroid inhalers, I can wean my patients so that they rarely use their breakthrough if needed on a bad windy day or something like that. Acne. Now, acne is interesting because acne is something that we all see, and there's a lot of Chinese herbs, there's a lot of Ayurvedic herbs as well. But again, it's just through signaling the inhibition of NF-kappa beta, which is a major inflammatory signal in the body, and it does it through this what they call TRIB3. So what we'll see is that I always like to treat it through using oral versus just topicals, because we know that the skin inflammatory response is actually internal. So if we fix the gut, which we'll talk about how that will work with using the CBD as well, and you clean up their diet, move them towards a plant-based diet, or avoid the common allergy foods like dairy and for stuff like that, and a lot of those things, then you'll see very quickly the acne improve. There has been a big push of using CBD topically, and it can be very helpful. The problem is the recent study just came out this week. I don't have the citing with me; just came out in my email box, but because I do a lot of research gate things that we pull out things from studies that are being published, but they found that a lot of the topicals have hyperallergenic, not hypo, but hyperallergenic, meaning a lot of chemicals, because there are people who are just making products, throwing CBD into some kind of cream base or something, and people actually have skin problems or allergies. So you always want to make sure that if you're using a topical, that it's as clean as possible, because everybody's like, oh, I got good CBD, it's either broad spectrum or full spectrum, and it came from a good source, but where are they putting it as the base? The base is something that could be causing a problem, just like all our body care should be clean as possible. So when we talk about arthritis, most of you see arthritis and rheumatoid being an acupuncture, seeing a lot of pain issues. Again, talking about how it lowers inflammatory responses, but this is the key to understand. Again, if someone has, so when we actually remove the fluid from the joints, okay, and we actually analyze it for the patient's own endocannabinoid system, okay, their own, they call it anandamide and 2-AG, which is the body's two own large endocannabinoids that it produces naturally. In someone that has a normal knee, no pain. So for me, for example, if I draw mine, send it to lab, those receptors are going to be in a resting state. They're going to be downregulated. And so I would need to take a lot of CBD to notice any benefits. Someone that has osteoarthritis, it's turned on, so they need a little bit less. And someone's got rheumatitis and they're flaring, those receptors are very active. And when why they're very active? Because the body's stimulating its own innate ability for repairing. It's sending out the macrophages. It's sending out, all these tissues responding. It's lowering the inflammation. It's doing the uh, chondrocytes in the joints and the bones and the tissue. It's looking at all these things I'm trying to repair. So when someone has rheumatoid arthritis, going back to the dosing concept, is actually they would take less amounts in milligrams than someone who has osteoarthritis, than someone who's just normal. I'm just got a little aches or pains. So it's just the opposite of what most people are running through in the industry. Everybody's taking like higher doses. So when you see a picture like this of rheumatoid arthritis, most people will think that you'd have to take a larger dose. And in fact, we start them low and go slow. Okay, relieving joint pain, swelling, suppressing joint destruction, and disease progression. So this is now an actually human patient. So this is very interesting that we can see this aspect, because now we can look at not just giving a biologic, unfortunately, which they do in conventional medicine, which suppresses the immune system and they have other side effects like black box warnings, but here we're looking at something that actually can help prevent it and actually improve some of the healing response. Heart disease, again, through inflammation. Okay, I'm going to go a little quickly here. Colitis here. Think of, a lot of you probably see tons of IBS patients, ulcerative colitis, Crohn's patients, right? And so when they actually take the colonic cultures from ulcerative colitis patients, because now we're actually testing this and looking at the targets of CBD, it actually helps reduce the intestinal damage. Okay, so this is really important, because now when I see a colitis patient, sometimes I will say, oh, instead of just taking it as a liquid, which is very helpful, it has a little bit faster onset, sometimes I will switch them to a capsule, so I can get a larger dose just right into the gastric and intestinal mucosa. And we can see here, like this, here's a little drawing here of the intestinal villi, the little villi in the GI tract lining. Remember, 35 foot of tract of your GI tract, the surface area is 2 tennis courts worth, right? So we have the CB2 receptors in the villi lining and also in the muscle tissue and the plexus. So, for colitis patients, it's not only do they have the leaky gut, the diarrhea, the constipation, and gastric bloating, but they also have the cramping aspect and the pain. And this is wonderful, because now when we actually take CBD, it can help. And in fact, for those people who have cancer, what I do in my clinic here is sometimes, if they, like in California, you have dispensaries. If the patient's interested, some places they actually do cannabis leaves, meaning they take the cannabis leaves of the cannabis plant, not the flower, and they juice it and they put them in ice cubes, and they take an ice cube once or twice a day, and it heals their gut, because we're just getting raw compounds. Anything that's juiced from the leaf, and we're not talking about the flower that has a THC, we're just talking about the leaves that they throw away, that actually has no THC because it's not heated, but it has a lot more of these CBD compounds. So there's a lot of things that we can do, just CBD from hemp oil, CBD from cannabis, that can be helpful just depending on what state, where the patient's at, and what's available for them. Diabetes, again, helps with inflammation. So we can look at helping, especially type 1 diabetes right now in the studies, and retinal problems with diabetes, and early pancreatic inflammation with type 1 diabetes. So these are things, when I see kids now, I get kids who are 4, 5, 6 year old type 1 diabetes, and the parents are now there, as they're getting older, have to give themselves injections. We use, once you start using the hemp oil, what we start seeing is there's less use and need, because we're turning down the inflammation as well as cleaning up the diet and everything else like that. With diabetes type 1, just letting you know, if you move people to a complete plant-based diet, you test their food sensitivities and you fix their microbiome, 50% of type 1 diabetics can get off of insulin within 3 months. Sometimes within a month, 30 days. The rest, 90% of them will have about an 80 to 90% reduction of their insulin. So we got people with insulin pumps. We get people for 20 years, and we used to think that this was like a lifelong disease, and this is about stimulating your own innate system to heal. When you think of Parkinson's disease, just go back to now thinking of those cells I talked about, the microglia cells, and turning down the inflammation. We talk about other cells that are creating the neurogenesis, creating the brain-derived nerve growth factor. So we're creating this neuroprotection by, again, using the astroglia, the microglia. So if you think of Parkinson's, then it'll be the same thing as any other neurodegenerative disease. Now, this is really cool. I want to show you this real quick, is that when we look at the cells, okay, so we're looking at the cells of actually looking at the animal model, but they stimulate Parkinson's disease by giving this toxin, okay, so that's how we do Parkinson's studies in animals, okay, and cell culture. And what we do is they create this toxin, and they count the differentiation of cells. And then when they add the CBD to it, you actually see there's actually an improvement of the neuronal growth of the cells. So it has this neuroprotective effect, that the little neurons off the cells are not broken up and destroyed. So we actually can see this in real time, in real culture. So same thing, if we have a control, we give nerve growth factor, which is what the body needs to grow, but you give the CBD along with it, it enhances the growth. So it's really cool when you start to see this, because a lot of times we miss it. We think about, oh, we hear all these fairy tales on the internet, or on folklore and Facebook and social media, but people have to understand, like, there's real science that's being worked on here, understanding our immune system functioning. Now, PTSD is something that you all will see. Everybody will see more and more as there's just more trauma in our country due to insults and injury and just stress. I see a lot of veterans in my state, and so I see a lot of PTSD due to serving our country. And we understand this. This is really interesting. Is that CBD is interesting? Is that the body's own anandamide is increased in the acute stage of trauma as a protective mechanism, and then it shrinks. It's reduced, and so there's an abnormal like signaling. So we understand that this PTSD aspect is its endocannabinoid dysfunction. It secreted it too much in an acute thing, and it's like it almost like burned. It's like, kind of like when you think of adrenal fatigue, and someone's like cortisol like goes really high, and then they burn out and they can't recover it because they kind of release too much of that. And the CBD, interesting, diminishes not only the acute PTSD symptoms, but more importantly, what we see is the chronic emotional reminders of the stressors. And this is actually in human patients now, these studies. So this is really interesting, because a lot of times we don't capture the patient in the acute trauma because they're serving overseas, or they got assaulted, or they had some kind of problem. But we do see the chronic person, right? They're oh, I'm going to therapist, I'm on these anti-anxiety pills. Can we actually just restore their function without suppression of symptoms and kind of diminish? Remember, our brain is not supposed to remember everything. If we remembered everything, we'd be miserable all the time. There's a certain part that we do want to forget, and it's not saying amnesia. It's like turning down some of these things that have kind of imprinted too strongly that then cause dysfunction. Same thing with traumatic brain injury. Traumatic brain injury, we know that there's chronic inflammation in the brain, right? Reactive oxygenation species start to increase, and then there's a calcium efflux and influx, so there's a swelling. And the traumatic brain injury can be resolved and improved with. And so right now there's a lot of research looking at football players. And so we all understand about the CT, chronic traumatic encephalopathy. Remember that this is actually brain tissue, and this is from football players. So remember, I think it was like 49 out of 50 post-mortem of the NFL players now that are in the legal lawsuit against the NFL. It's because they all have these, they had early deaths, they had suicides, they had PTSD, they had all these kind of neurological early Parkinson's disease in their 50s and 40s just from chronic treatment. So every time they have this head injury causing the inflammation, and now we're looking at what if we were to give this to them in their college years or high school years, and because they're not going to stop playing. Unfortunately, I'm not a big fan of the hitting head sports, but they will still play. It's an American thing. So how can we reduce their long-term morbidity and mortality? Is maybe we should be increasing this or adding this to a regimen, not just saying wearing a helmet. What else can you do? And so again, same thing that is similar to the Parkinson's disease. We're looking at turning down inflammation, neuroinflammation, and also improving the growth of new generation of cells. So it's a combination. Once you understand those four cells in the brain and the blood-brain barrier, inflammation, and immune system, then we understand that it applies to any kind of pathophysiology that happens in the brain.